This video is a tutorial on how to get back to swimming after ACL reconstruction surgery. Although you may want to, you cannot jump in right away. You have to start slow. This is the correct way of getting in the pool. Keep your bad leg straight and follow the pattern of step together, step together. You do the same thing coming up, except you lead with the opposite leg. Bend your good leg and keep your bad leg straight, following the pattern of step together, step together. If there are no stairs, just hold on to something and slide down, trying to keep your bad leg as straight as possible. After about 3 weeks, or once the incision wounds are healed, you can get in the water and start swimming with a pool boy. It is best to keep your legs as straight as possible since they are still healing. Practice good body position and technique while you are still recovering. One of the first obstacles you will have to overcome is learning how to do a turn with one leg. Simply just push off with one leg like you see here. If you feel totally comfortable with that, maybe try a flip turn, but only push off with one leg still, and try to keep the other one straight. Just being in the pool is actually really good for your knee. For one, the impact is reduced because of buoyancy, and about 50% of your weight is taken off. Dynamic resistance is the resistance of water when it presses against you, and when you move, it can also strengthen your body. Lastly, hydrostatic pressure is the pressure of water against your joints, which reduces lactic acid, reduces inflammation, and massages your joints. This will increase blood flow to the area, especially with movement. The squat jumps will help stimulate this motion. Here's me swimming backstroke with a pool boy. This helped my backstroke a lot in the end because it worked on my balance and body position. When you start kicking for the first time, it may be pretty frustrating because you will think you have made so much progress and then you are introducing something completely new to your body. You will also be doing a full stroke like everyone else, but will probably be going much slower like you were before. You may even hear some scary clicking noises in your knee, but that is nothing to worry about. It's just your body's way of getting used to something new. The best thing to do is just to be compassionate with yourself and don't beat yourself up. Give yourself time. Emotional healing takes longer than physical healing. Once you can push off with both legs, work on your underwater progression. This is me just floating. Over time, progress to a few light kicks, focusing on the undulation of the upper body. At about 10 to 12 weeks, you can increase your force and range of motion, but be careful with the whipping motion. At about 12 weeks, I was swimming butterfly regularly in practice. Once you get your dolphin kick down, you can do breaststroke with a fly kick, but be cautious because breaststroke kick is the hardest kick to come back to. This is a drill from the USC's head coach, Coach Salo. You use a kickboard as a pool boy, and then you angle your leg at a right angle. At about halfway, you can switch legs. This works on your back hamstrings, which is really important if you have a hamstring graft. Using a kickboard as a pool boy is key to recovery. One, because it mixes things up when all you can do is pull. Secondly, it works on your body position and core. And thirdly, it really works your glute muscles, which is critical to recovering. When you do isolated kicking, start very slow. Over time, you can build up speed, but this will be a lot for your knee at first. Same thing with butterfly kick. Focus a lot on your upper body and the undulation. Don't always focus on the whip. Be very cautious of that. There are some days when my knee hurt too much to swim, so I sat in the side of the pool with my legs up. This is good because it soothes swollen or cramped legs, it increases circulation, it strengthens the hamstrings and lower back, and it relieves tension. I also did exercises on the side of the pool that didn't bother me and helped me gain upper body strength or core strength. Studies have shown that better HQ strength ratio was seen in core stabilization group. Core stabilization exercise improved postural stability more than classic rehabilitation. Core work is also good for swimming and health in general. I hope this video helps and gets you back into the water a lot sooner.